Good evening. We've been hearing a lot of facts and talking about Medicaid and whatnot. Let me share a story. I'm a physician, you all know, and I see geriatrics, that's my specialty. One fine day, like any other day, I went to my office to see patients, and I see Ms. Jones. After looking at her, doing her history, physical assessment, I see, Ms. Jones, I think you're not taking your medication. She was very polite. She said, no, doctor, you know what? I was at my daughter's home. I may have missed 2-3 days of pills, but I'm very regular. Don't change anything. I said, okay, I trust you. And we left. Next month, I again see Ms. Jones in my office. Same procedure. I go through pleasantries, do her history, physical, look at her, and says, Ms. Jones, something is wrong here. I can tell that you're not taking your medication. She puts her arm around my shoulder and says, Doc, you know what? I'm not taking medicine because I don't have insurance. I said, okay, you know what? Have you heard about those $4 pharmacies? I went with her, go through all our medication list, and we changed some of the medication. I said, if you don't, these are $4, and you should now take all those medicines. All fine and dandy. She goes home. Next time, on the third visit, I see her again. We go through, this time I was a little upset, like trying to be smart. I said, I know you're not taking your medication, and what is your problem now? Because we went through the list, and I gave you those $4 medicine, and she looks at me with tears in her eyes, and she said, Dr. Lalani, you know what? I'm on 8 medicines, and my husband, John, is another 8. 16 times 4 is a number we can't afford on our Social Security check. That night, I came home crying. And that time, I made a decision that I need to not take care of ailing patients, but also take care of ailing policies. How many of you know Ms. Jones in your life, that they are rationing their medications? How many you know of people who are husband and wife sharing and they are non-compliant because not they're out of their will, but they cannot afford? How many of you know people who are doing 2 jobs and don't have insurance? You know, we are penny wise and pound foolish in healthcare in our state, and we need to be more proactive than reactive. People were asking questions, where will you get money from? The question is, where are we losing money from right now? Because people who are not insured, when they are not taking their medications on time, when they have complications that can be prevented, and they end up in the hospital, who's paying for it? Our state is paying for it. So we need to be we need to be more smart than that. So vote your conscience, not vote the number. Don't vote your party, because you know what? When diabetes hits you, it hits you. It doesn't see what faith you belong to. It doesn't say what color of your skin is. It doesn't see even you vote or don't vote. It's going to have its complications. And you know people who have diabetes for 40 years and they're having normal life. And you also know people who have diabetes for 3-4 years and have limb amputated. What is the difference? Compliance to the care. So please vote your conscience and not the number. Thank you.
Mr. Anchia, for what purpose?
Thank you, Mr. Speaker. Will Dr. Lalani yield for a few questions?
Does the gentleman yield for questions?
Yes.
The gentleman yields.
Dr. Lalani, thank you for your heartfelt words as a practitioner in the field. I'm sure you run across people on the daily basis that have difficulty receiving care because they don't have insurance. Is that correct?
Yes.
And one of the arguments that has been raised today, which has been, I think, especially troubling and speaks to the lack of information that people have, is that somehow people who are non-citizens are eligible for Medicaid. Medicaid. Is that right?
Well, Medicaid has its own requirements, so they have to go through the processes.
And it is actually true that you can be a non-citizen and receive Medicaid, but you have to be a legal permanent resident if you are a non-citizen. Is that correct?
Correct. I think, as I said, it has its own regulation and its own requirements. So you have to fulfill all those requirements to become eligible and get the insurance.
So in order to be eligible, you have to be either a U.S. citizen or a legal permanent resident, like my father was for over 20 years in this country before he became a citizen. And that determines your eligibility.
Correct.
I want to ask you about children and giving birth. Have you? I don't know if in your practice, have you ever delivered a child?
In my training, but not in my current
Okay,
practice.
so in your training, you've had the extreme good fortune of being able to deliver a child, correct?
Yes.
And that beautiful miracle of life, I've heard denigrated here somehow on the House floor with people complaining that 58% of births in the state of Texas are somehow bad because they're in Medicaid. Did you hear that narrative from the back mic?
I'm sorry, I didn't understand you.
Sorry. Someone complained that from the back microphone that 58% of births in this state are as a result of Medicaid. Did you either understand that data or hear the complaint from the back mic?
Probably, I didn't hear that, but
Well, I did.
okay.
And it is frustrating to me when people beat their chests and claim to be pro-life and then denigrate the miracle of life when children are born in this state under Medicaid. Is that also troubling to you?
Yes.
And as a result, people who say that they're pro-life, in voting against this, will be also voting against healthy pregnancies, prenatal and perinatal care. Is that correct?
Yes.
So that children are born with the same advantages regardless of zip code. Is that it right?
Yes.
And there's a curious little detail that when you're born in America, you're an American. Is that not right?
Yes.
And the Constitution says that, doesn't it?
Yes.
And so, Mr. Lalani, I'm glad that you put a face to this debate, not only as a practitioner, but with the patients that you serve, because in the end, this is about taking care of our brother and sister, our fellow Texan, the mother who may not have money to take care of her expectant child, right? And in the end, in voting for this, you're supporting that mother, you're supporting that neighbor, and you're supporting that Texan. Is that not right?
This is true because this is a health issue. This is not a partisan issue. This is not a Democratic issue or a Republican issue. This is a Texan issue, and we need to take care of it as a Texan issue.
Thank you
and
for your
we
words.
all can come out today as winners. You be Republican, you be Democrat, go to your district and be proud of it that you took care of your Ms. Jones in your district. And we all come out winner in this today. Thank you.
Thank you, Dr. Lalani.